there, Carmen here. I am a myofunctional therapist and I have a global online practice, which means thanks to teletherapy, I see people all over the world, and I love that I can bring this important therapy to places who otherwise wouldn't get it. So today, what are we talking about? We are going to talk about all things frenectomy. Well, maybe not all things. We're going to talk about 3 things frenectomy, okay? So we're going to talk about what it is and why does a tongue tie happen, who should do it, so who should have a frenectomy, and then when should it be done. So let me just back up. One of the biggest parts of my business is clients who have tongue ties. So I get so many questions about this. So just want to make sure that you have all of the resources that you need at your fingertips. So first of all, let's talk about what is a tongue tie and why does that happen. So when I'm explaining this to clients and I'm trying to just give them the easiest generic story, I just say that a tongue tie happens when basically cell apoptosis, so which is cell death, the tongue does not completely finish differentiating out of the floor of the mouth. So a lot of people who have a tongue tie, they operate like this. The tongue and the jaw operate together, and that can lead to a lot of issues. Some people have TMJ issues because their jaw does the movements that their tongue is supposed to. Of course, they don't know that. But this happens really early on in utero, real early. And so this, that tongue tie, by 10 weeks in utero, that tongue tie is there. So that tissue, it just didn't finish. Some people's frenum, we all have a frenum. So don't let that throw you off if you look under your tongue and holy cow, you see something there. I have a really pronounced frenum, or some people call it a frenulum. And some of my very own clients will email me and say, Carmen, you have a tongue tie. Which is not the case because we don't judge that. We don't diagnose that based on just how it looks. I have 100% range of motion, but I have a very prominent frenum. Some people have a really short, thick frenum. Sometimes it's where it attaches on the tongue. So it would just make sense to you if you have if you have a rope and it's attached out here, your lever doesn't lift very well. But if it's attached here, you're going to have some movement here. Really, the important thing is we want this movement. The whole tongue is so super duper important. But a lot of people who are not educated in tongue ties, they just worry about this. And I don't really care about that. I do, but I'm worried about this. That's the most important thing for me when having this conversation with my clients. So in a nutshell, the tongue does not finish differentiating out of the floor of the mouth, or a better description is that frenum. It might just be really tight, really thick. It depends on where it attaches on your tongue, where it attaches on the floor of the mouth. So that explains that. Next, let's talk about who should do a frenectomy. So adults versus children. I get this question a lot. Kids are the most important, and just really for a little bit different reason. But age really matters there too. So when I do therapy with clients, they need to be old enough to comply, cooperate, and comprehend with therapy. So clearly this is not going to be a 2-year-old. This is not going to be an 18-month-old. So in my practice, and through a lot of providers who have mentored me, if a child is beyond the nursing years or months, I should say, there's not a great reason to just jump in and do a frenectomy. If that child's going to be in that time that makes it difficult, they're not going to comply. So that's why I always say kiddos are more important, but definitely, and it's important in that time frame. But you could look back at a lot of my different videos. We talk about this time frame. So that's not really what I wanted to dive in here. What it does matter about for children is that we want their face to grow properly. We want their airway to grow properly. So that's what I mean. So we don't want to wait till they're 12 to intervene, okay? We want to get a hold of them as soon as possible. 4 is great. I have some clients who start a little bit earlier, and that's because they want to get that frenectomy taken care of because of speech issues. But really, it's a case-by-case basis, and it depends on the child and how they're going to cooperate. Adults should have something done about their tongue tie also, but it's for a little bit different reason. And I stress to adults all the time, you are not sitting in a room on fire. You do not have to make these decisions overnight. You have to assemble the right people on your team. And so that's why that timing is a little bit different. But nonetheless, both adults and children should have a frenectomy. Everything needs to be just right, okay? And then last, when should it be done? So that kind of goes back to the same thing. It should be done as soon as possible, provided that everything else is aligned and done properly, meaning proper pre-procedure therapy. So for me in my practice, that's a month before, or a little bit longer if I have a client maybe with some higher needs or somebody who's really overzealous. But as a rule of thumb, a month before is great. So that should help at least give you a little bit of an idea. Now, as always, I'm always on Wednesdays going live in my Facebook group. So today I'm going to be talking about 5 of the most common questions regarding a frenectomy. Okay, so you can catch me live today over on Facebook at The Tongue Trainer. I'll be there at 11:30 Mountain Standard Time this morning. If you're wondering about how to get started, you can just find your myofunctional person. You might be able to find somebody in your local area. If not, you can find somebody like me who sees clients online. So I see all of my clients via, the internet. And for a lot of people, that is very efficient and it's what works for them. So regardless, the most important thing is that you get started. One way you can get started is to download my free assessment tool, and that will give you about 25 questions to kind of just walk yourself through, or maybe your kiddo, and see if there are any of those big myofunctional red flags that are saying, hey, there's a concern here. If that sits with you, if it resonates with you, if it screams your name, if this is describing you, then I encourage you that you should find a myofunctional therapist to work with. Another great place you can get support is I have a Facebook support group called the Tongue Tie and Myofunctional Therapy Support Group, kind of a mouthful, but there's a lot of great resources in there, and it's a great place for conversation. So it's a great community to help you on this journey. I will see you over at the Facebook Live at 11:30, and I will see you in the next Myo Minute. Bye for now.